Okay.
Great, thanks, Chris. Hi, everybody. Thank you for joining our latest Northwest Inclusion Team webinar. So some of you will know that we're heading towards Refugee Week, and we really wanted in the Northwest to learn more about and celebrate the work that some of our colleagues are doing to support refugees coming to work with us, to meet both our organisational needs, to recruit more staff, but also to lend a helping hand to people to build skills who are less fortunate, and you can have a chance of building a new life in this country with us. So I'm really, really pleased to introduce Debbie Tickle. Debbie is the recruitment manager over at Lancashire Teaching Hospital, and she's going to talk for a few minutes with us about the work that they're doing, some key learning, some of the outcomes, and also some of the things that managers could learn if they were going to be thinking about doing a similar initiative or leading a similar programme. Hi, Debbie. Thanks ever so much for joining us.
Oh, you're very welcome. Nice to see you.
Tell us a little bit about your role, Debbie, and a little bit how you got involved in this work.
So I'm recruitment manager and I deal with all non-medical and dental recruitment within the organisation. And last year we did quite a large international nurse recruitment programme where we recruited 361 nurses, international nurses into our organisation. And part of that was linking in with Steve Colfer at Health Education England in the Northwest. And he was running a programme for refugees. And we were invited to a webinar, went along and just thought, wow, what they are delivering was absolutely fantastic, and we really wanted to be involved. Well, I personally really wanted to be involved. So when they asked for volunteers for cohort 4, I went to speak to our exec team and said, what do you think? And they were just, again, were wow, yes, this is something that we need to do, not only from a recruitment point of view, not only from filling our own vacancy gaps, but as a public sector organisation, as the NHS, we should be supporting people who are less fortunate than ourselves. And this refugee programme just fit in nice with our inclusion strategy, and we just went with it.
So tell me, I know earlier we were discussing this. Tell me how many people you successfully brought over.
So we brought over 5. Well, we brought over 4 in cohort 4, and 1 we couldn't get a visa in time, and he came over in cohort 5. So we currently have 5 international recruits who were refugees. Most of them came over from the Lebanon. Some were Palestinians. There's a quite a wide range of nationalities between the 5 of them. There were 3 men and 2 women, and they came over in February. 4 came over, and then 1 came over in April.
And one of the things you described to me earlier was what sounded like really good pastoral care. So arms around them to meet their needs. They come from challenging situations, they come from different places, they come from different worlds and environments. Tell us a little bit about some of the stuff that's in place and how the impact you think it's had.
I think one of the things that attracted us to the programme that was being led by NHSEI was the fact that they weren't just brought in country and then left with us right from the very beginning. They did have like a familiarisation programme over at Liverpool with John Moores University, where there was a large group of these refugees who came over together, went to John Moores, bonded together and learnt about the country, learnt about the NHS, and did some clinical skills work. So there was a lot that was done prior to them coming to us, so they didn't come to us immediately. And then as part of the programme that we have as our international nurse programme, we bring them into, obviously, Preston. We went to meet them at Liverpool, collected them, brought them back over to Preston, and then we supply them with 12 weeks accommodation, because obviously we realise that people don't or can't arrange their own accommodation when they're in the Lebanon or, in I can't think where the other ones came from. Sorry, my mind's gone blank. But we understood that it's not easy for them to be able to source their own accommodation. So we gave them 12 weeks paid accommodation. And then part of our aftercare is that we then help them to source their own accommodation, speaking to agents for them, landlords, writing them references, anything like that. We also have a dedicated pastoral support person who looks after all of our international nurse recruits. She's been absolutely fantastic. She is available almost 24 hours a day, it feels like sometimes, to welcome the recruits, to help them. She's dealt with lots and lots of issues, including mental health issues. Obviously, people come over, and certainly I think the refugees, because they've come from a very stressful situation and have left their families in that very stressful situation to come over to work for us, they have needed that extra support, and we recognise that from the beginning. We knew that they might need a bit more arms around them, a bit more holding, and a bit more encouragement or support while they're in the UK.
And these are registered nurses?
They're registered.
4 or 5 registered nurses, yeah?
Yes.
So they're working in all sorts of different clinical settings across your provision, yeah?
Yep, they are. Obviously, they're not registered with the NMC when they come over. However, they are registered nurses in their own country. So these are people who have been working in clinical settings for years and years, some of them in very senior positions, who are coming to make a new life for themselves and their families in the UK. So we do have to support them. They come across the senior healthcare support workers, and then whilst they are here, we will help put them through their OSCE training, their IELTS, because they still need to meet the English language requirements of any international nurse, and their OET. We fund that for them for their first attempt, so we support them, we give them training, we give them study days, anything like that. And we also recognised early on that some of them may not work at the same pace. Some may want to become registered nurses really, really quickly, because obviously they've worked for years and years. But when we first met with them, and they met with our director of nursing, Sarah Cullen, she was quite clear that we will go at whatever pace you want to go at. And I think that was quite important for them, and it was quite reassuring that for them to hear that. We sponsored them for the 3 years, but our intention, we gave them a permanent contract from the off. And our intention was that we want them to stay with us. We want them to bring their families over. In fact, one of them has actually brought his family over already, and they're nicely settled in Preston. But that's our long-term aim, that they will stay with us, and they will stay with Lancs teaching hospitals, and will then progress to registered nurse positions. But we did make it clear to them from the start, if they want to stay as a senior healthcare assistant, then that's absolutely fine with us. We will support them to do that. And they, our main aim was to offer them what they wanted, which was to come to a country that was safe for them, was safe for their families.
It sounds an amazing initiative. Presumably they come across, they bring their clinical skills.
Yes.
They bring skills from working in different healthcare systems. What else do you think they add to your multidisciplinary teams? Do you think they bring anything else with them?
Absolutely. I think that they along with our other international recruits, and obviously we did quite a large international recruitment campaign last year, they bring so much more. They bring different ways of working, different attitudes to things. They really make us stop and think about what we have in terms of in our own country. They make us think about what they've been through, and how they've managed and how they've survived. They bring great resilience with them. They are absolutely fantastic. The patients love them. The patients love all our international recruits, because they bring something that's very different.
And if I was a manager and I was experiencing staff shortages, and I was looking at ways of recruiting particular communities or groups, what might be some of the messages you would share with me from your learning about this particular group?
I think this particular group, one of the mistakes that we made in the beginning, and we learned quite quickly, was not having proper conversations with them about where they wanted to be when they came over. We were thinking more of an organisation where we would want to place them in terms of being able to support them, but that might not have necessarily been in an area that they were familiar with, or they wanted to particularly work in. So that was one of the areas that we really did need to look at. And I think as a manager, you also need to think about the support that you can give them on the wards, because it's really important. Whilst we can give them lots of pastoral support, and we have charities involved with being able to give them that pastoral support, like Neighbours for Newcomers, who were fantastic, and a couple of those were refugees. What was often missing, or what we learnt quite quickly was missing, was that support on the wards. You really do need a buddying system, and it's best to buddy them up with another international nurse who obviously has been through exactly the same and knows what these people are going through.
No, that's great. Thank you. Is there anything that you would have done? You've mentioned a couple of things. Is there anything that if you were to run the programme again, you might do differently, or what's it learned? Have you grown as an individual through this?
Absolutely, absolutely. I think it's the little things. The big things we did fantastically well. We made all the arrangements, getting them from the airport into our accommodation. But it's the small things that you forget about. Paying them. That was a major issue for us because you don't realise how difficult it is to open a bank account when you're a refugee and have very limited documents that you can bring with you. They usually only have one document, which is their travel pass or their passport. So it was those sort of things that really made us stop and think, what do we need to put in place if we did this again? Cash advances, trying to get cash advances. It's not something that we do an awful lot in the NHS, but having to arrange that beforehand and also think about what if we don't get a bank account within the first month? How are we going to manage the wages? And other things was cultural differences, putting them into mixed accommodation. That didn't work very well, and if we did it again, then we would think differently around how we place people. And simple things like food, the amount of baked beans that we have left over, because actually baked beans is absolutely alien to people who are coming from India or the Lebanon. They don't understand baked beans in tins and don't understand what our obsession is with them.
Me neither. I understand. I'm on the page with that. I'm not a baked bean person. But that's really interesting. Those little nuances that we don't understand are so important, aren't they, to make these people feel welcome as colleagues, as skilled clinicians in our workspace. It's really important we get it right. So you mentioned cohort 4, cohort 5, I think. Is this now a rolling programme? So is this going to continue?
I think it's going to continue across the Northwest, and we would love to be we would love to take part in another cohort because it has been so successful for us. They just bring so much, and when you meet with them, the joy that they have in being in country and being able to help somebody to bring their family over, to liaise with the Home Office to make sure we've got the right documents in place, to make sure we've got accommodation in place. It really does make you sit back and think how lucky we are to be able to live in the country that we live in and not to have to go through what some of these people have been through.
No, I totally agree. That sounds a really amazing initiative. Thank you for the work you're doing in this space, because it will make a difference to all of those people and people to come. And it's really important that we're doing this together. So I really thank you for coming and talk to us. Is there anything else that you'd like to share before we let you get on?
I think all I'd like to share is just don't be afraid to to say we'd like to have a go, and don't be afraid if you want to get on the phone to me at any time to say what have you done, what have you managed to do. Just absolutely don't be afraid to take part in it. It's been absolutely fantastic, and we are well on our way now to getting these people registered and being able to work with us as registered nurses and to develop their career within our NHS, but also it's a knock-on effect to our wards as well, because they are filling gaps that we cannot fill locally, and we need to be more creative in the way that we are recruiting people. And it's only a small number that are coming over, but it's just a fantastic opportunity for both them and us.
And this is part of a bigger programme, isn't it, led by HEE? So people may see something about this more locally to them. We're talking with you because your name came up in a conversation. We had a conversation. I knew you want to share your story. People may see iterations of this more locally to them across the Northwest, mightn't they?
Absolutely, the Northwest and the whole country, yes.
Absolutely. So you're happy for people to reach out to you if they'd like to just talk it through, maybe find out some of the trip hazards or some of the things to avoid to get the best possible outcomes for the people we're describing. Fantastic.
Absolutely. And I'm more than happy to share some of the things that we've put in place in our protocols and the information that we give out to the refugees when they first arrive.
Debbie, thank you. That's really, really good of you to spend time talking with us. We really appreciate it.
Not a
Thank you
problem.
so
Thank
much.
you. Thanks.